COVID-19 vaccinations are strongly recommended in pregnancy to protect both the pregnant woman and the baby. We know that our uptake rates here on the Isle of Man have not been as good as they could be, and we'd really like to take this opportunity to encourage all pregnant women to think about getting the vaccination. Vaccination is the best way to protect against the known risks of COVID-19 in pregnancy for both women and their babies, and that includes reducing the risk of needing admission to intensive care and, for the baby, the risk of premature birth. More than half of women who test positive for COVID-19 in pregnancy have no symptoms at all, but some women will get life-threatening illness from COVID-19, particularly if they have underlying health conditions. And in the later stages of pregnancy, women are at increased risk of becoming seriously unwell with COVID-19. That is largely related to the fact that in the third trimester, the baby is getting much larger, and that itself puts pressure on women's lungs, which makes them more susceptible to respiratory infection and more susceptible to serious complications if they do get infected. So that's why it's particularly important to get protection from the vaccines in pregnancy, and particularly to get the vaccines before you get into the third trimester. COVID infection can also affect the pregnancy itself. So in pregnant women with symptoms of COVID-19, it's twice as likely that their baby will be born early, and that exposes the baby to all the risks of prematurity. A recent study also found that pregnant women who tested positive for COVID at the time of birth are more likely to develop preeclampsia, and they're more likely to need an emergency caesarean. And very sadly, their risk of stillbirth goes up to about twice what it would otherwise be. So even though that means the overall numbers of stillbirths still thankfully remain very low, it does represent a significant increase in risk, which can be avoided altogether by having the vaccination. The risks are actually incredibly few. In pregnancy, we only recommend the use of the Moderna and the Pfizer vaccine. So the AstraZeneca, with its known association to rare blood clotting events, wouldn't be offered in this situation. So it would be Pfizer and Moderna. Those have been used extensively, particularly in the US, and at the time that the Joint Committee on Vaccination and Immunisation recommended offering the vaccination in pregnancy, there was data on over 130,000 pregnant women and pregnancies from the US on which to base that evidence. That evidence has since grown. There has been a Scottish study looking at the outcomes in 4,000 women, and there is an ongoing surveillance study, and the data from all women receiving vaccination in pregnancy is monitored, and the outcomes for them and their babies is also monitored. So we really do have a very good evaluation system in place here to assure us of the safety. Obviously, some women are particularly concerned about any potential risk during that very important time when the major parts of development of the growing fetus are underway. So anybody that is concerned about receiving vaccination in the first trimester should talk about that to their midwife to make the right decision for them. But overall, the safety data indicates that vaccination is safe throughout.
I would suggest that most people would be more comfortable to wait until after the 12th week of pregnancy. You, as a pregnant woman, would be offered the Moderna or the Pfizer vaccines. Absolutely, you may speak to your midwife or your obstetrician at any time. Just get in touch with them. We would also like any woman who is pregnant who has tested positive either using a lateral flow test or on a PCR to contact the maternity unit and let us know. We would like to know whether you're positive so that we can put into place a risk assessment and offer you any extra care that you may need.